Hydroxychloroquine doesn't do much to treat COVID-19 and can be super dangerous when taken with certain other drugs. But dexamethasone, a really common steroid, is actually super useful in treating COVID-19. Let's talk about how we know that. Hi everyone, Shri here. Back in March, there were 3 things that convinced us that hydroxychloroquine might be a good treatment for COVID. A bunch of studies in lung cells and plates seemed to show that hydroxychloroquine reduced the virus getting into the cell. A Chinese study of 100 patients said that hydroxychloroquine was better than some unspecified standard of treatment, which is sort of sketch. But the most important one was a French study of 20 patients that seemed to show that hydroxychloroquine lowered the amount of virus in the blood. But there are a few important flaws in that study. For one, 20 is a really small number, and while the original study had 26 patients, 6 were left out because they either left the hospital, ended up in the ICU, or died. This study was published on medRxiv and has since been retracted. Since then, a lot of other studies have come out from a lot of different places. In the US, a study in the BMJ showed that 53 out of 75 people given hydroxychloroquine got better. But 56 out of 75 people got better with just standard care. So for those 3 patients who were on hydroxychloroquine who maybe could have gotten better with standard care, this was kind of a raw deal. So the clinical trial was actually stopped early. But even then, 75 is a small number, so this is where UK's national healthcare comes in handy, allowing scientists to consolidate results from 11,000 patients from all over the UK. This trial, kind of cutely called the recovery trial, tested a bunch of different treatments, among them hydroxychloroquine. They gave about 1,500 patients hydroxychloroquine and compared it to the approximately 3,000 who got normal treatment. In that study, 25.2% of people being treated with hydroxychloroquine died, compared to only 23.5% with normal treatment. So in theory, 33 people who got hydroxychloroquine may have lived without it, which is why they stopped that entire treatment and closed the arm of that trial. The recovery trial also showed that the HIV drugs leponavir and rotenavir also aren't that useful for COVID, but that's a separate story. This was the big thing that led to the US revoking emergency use authorization for hydroxychloroquine. And there's been a ton of other studies since then with different groups and different people from all over the world. So basically, it seems like hydroxychloroquine at worst is not as good as the standard treatment of oxygen, supportive care, and antibiotics, and at best, maybe equal. But there are risks with hydroxychloroquine, especially when combined with other drugs, like azithromycin, which messes with how long it takes your heart to beat. So ultimately, hydroxychloroquine should be left to doing what it does best, messing with things that have a lot of acid in them, whether that's little bubbles in malaria parasites or immune cells which are going wild, like during rheumatoid arthritis. But what else do we have for COVID? Well, something you might not have heard too much about is dexamethasone, a super low-cost steroid which has actually reduced deaths in patients on ventilators by 1/3, and by 1/5 of patients who are receiving oxygen alone. But it doesn't appear to be that useful for patients who don't need help breathing. So for the rest of us, the best thing to do is to avoid getting the virus by wearing masks, socially distancing, and washing our hands. And that's the cutting edge.